students, because they were a susceptible age group relative to the rest of the population. And in the second wave, in term 2, there was disruption because illness was sweeping through teachers and schools were having to close down. What I'd say now is what's really important for our young people right now is, having experienced a lot of disruption, it's really important that we help them get back into rhythms. That we give them as much stability and consistency as we can. And there are measures that the government has put in place to try and keep schools open as safely as possible. Those are really important for school communities to be following right now.
Okay. What, generally speaking, we are still in winter, and though COVID cases are slightly down on where they were a couple of weeks ago, what could people be doing with regard to both COVID and winter wellness more generally to sort of keep themselves safe and well at this point? One for the floor.
Yeah, so it's definitely good to note that it's not just COVID that we're talking about. Lots of these measures, lots of these simple public health measures that we put in place and layer up, they're going to work for a lot of different things. And we've seen influenza come back. We might see RSV come back. We had a big wave last year. We might see things like measles and whooping cough and all those other things. And this stuff, this basic public health stuff, looking after each other, masks, vaccines, ventilation, staying at home when you're sick, following that isolation advice, all that sort of stuff will actually help us across the board. So I think it works against COVID, but it's also an opportunity for us to frame it a bit wider and to apply all that stuff that we've learned over the last couple of years to all these other things that we might see come back.
A really important measure that parents should be thinking about now for their children is to make sure that children who are under 5 are all caught up on their routine vaccinations. Over the last couple of years, we've seen, and this is a global trend, this is not just isolated to New Zealand, but we've seen a trend where our routine vaccinations, protection for measles and whooping cough and rubella and other really serious conditions for children, they've sort of fallen off and had to take a back seat. What we need to do now is rapidly get those vaccination levels back up to protect our communities. In 2019, we did have measles come through. We had an outbreak, and there were over 700 people in hospital then from measles, and lots of those were children. So, if there's any parents out there listening, I just say please make sure that you and those that you love and care for in your community are all up to date with their vaccinations, because a measles outbreak could be just one plane ride away.
On the topic of immunity then and protection, we had a question come through asking whether it's possible that some people have a sort of inherent immunity against COVID-19. So whether, take a family, for example, mum and dad might get it, the children might not, or vice versa. Is there something like that in people?
It comes up all the time, and I remember an article recently printed in Staff that said, is it good genes or is it something else that gives some people in a household protection over and over again to avoid COVID? I think it's probably behavioural, to be honest. We were just talking before about situations doing to avoid getting COVID. Because, you don't want to get COVID once. You definitely don't want to get it a second or a third time, because as time goes on, you end up running the risk again of long COVID, or, our hearts and lungs don't like repeated infections.
Actually, on that, what do we know at the moment around people's experiences of reinfections? Is it anecdotal? Do we know if people are suffering more mild illness the next time around, more severe illness the next time around? Is there any rhyme or reason to what's happening with reinfections at the moment?
Reinfections are more common now than they were with the ancestral COVID or with Delta. So what we're seeing now is more people reporting, I had COVID early on in the year and I'm getting reinfected with COVID now. Or even, there are reports of people saying, I've got COVID again and it's only sort of 31 days, for example. So that's definitely true. For the vast majority of those people that are vaccinated, they will have a mild illness if they are fully up to date with their vaccinations, they're otherwise fit and well. But it's kind of like rolling a dice. Each time you get exposed, you run the risk of getting long COVID again, if you missed it the first time. So no matter how mild it was last time, don't always imagine it's going to be the same again next time. Some people, their lungs didn't recover, and getting another illness on top of it puts them back even further as well.
Okay. Jen, this might be one for you. On the topic of vaccines and immunity, what do we know about countries who are vaccinating under 5s? What does that sort of look like at the moment?
It's very early days. So, I mean, it's promising in that Pfizer and Moderna, two big pharmaceutical companies, have got vaccines out there and have got FDA approval to roll out vaccines. And the United States has just joined a very small handful of countries around the world that are rolling out a vaccine for the 6-month to 5-year age group. Typically in New Zealand, we follow a really careful process around approving vaccines, and it's early days. I don't think MedSafe has received an application yet, so we've got to wait, and it's smart to wait. We did this for the 5 to 11-year vaccine rollout as well. We waited to get good data from overseas to see what the efficacy was like and to check safety as well, because the trials are big, but they're sort of small. If you're talking about vaccinating a whole population, we really want to look for any rare side effects, make sure that it's extremely safe to give to our children before giving it. So I just say patience in the meantime, take all the standard precautions that we've been talking about, and let's wait for our experts to check out whether those vaccines are recommended here.
Yeah, okay. And a follow-up question actually on vaccinations for those slightly older tamariki. So it's looking like about, or just over half of 5 to 11-year-olds across all ethnicities have had 1 dose, and slightly under a third, so I think it's about 29% have had 2.
Yes.
Where is that? I mean, in terms of, the sort of sliding scale of satisfaction of uptake, is that sort of lower than we had anticipated?
I think what I'd say there is ideally we'd love to see vaccine rates higher, and if there are parents who are out there who are sitting on the fence about getting their children vaccinated, I'd say yes, please do it. It's a great idea because it will just extend their immunity even further. So even if your child's already had an Omicron infection, getting them vaccinated after their infection will top up that immunity and give them relatively more enduring immunity. So we would really like parents to take up that free immunity, if you want to put it that way. But in terms of how New Zealand is positioned globally, we're actually doing quite well compared to countries that we compare ourselves to. Right. So there are factors at play here that are outside of just the New Zealand environment. We're on par with Canada and Australia, and we do need to catch up on those second doses now because our first Omicron wave just interrupted our vaccine rollout a bit. So if you've had if your child's had a COVID-19 infection already, just wait 3 months and then complete the course. That's the best thing that you can do for their COVID immunity.
Okay. Nick, one for you. We were contacted by a couple of people asking about, I guess, sort of risk assessment around masking in various settings. And one was, is it okay for a person to take their mask off in an indoor venue if there are not loads of people? Or would the advice be to indoors remain masked where possible?
So I think, again, it's always about layers, and it is a difficult risk assessment for any individual person to do. So the ventilation and the people in there, that stuff does count, but the safest thing to do is to wear a mask when you're in an indoors environment that's outside of your home, and also to think of the other people that are there, because a lot of wearing a mask is for other people. It's not necessarily for you. So that's always something. We're more connected than we might think to people who are potentially vulnerable or potentially, more likely to have a more severe outcome if they get it.
Okay.
And we're sitting here 4 people. We walked into the office today. We declared we had no symptoms when we registered. We were wearing masks before we came through. Other people in the newsroom are wearing masks, but we've taken the masks off and we're in close proximity. But there was other checks that we went through to make that, calculated risk assessment and decision when we took our masks off. So it's difficult because people want a really clear answer as, like, if you're in a room with 5 people and open a window, your risk of getting COVID is 0. It's just not that simple. If there's someone sick in the room, your rates are going to go up. You want to you know, take yourself out of that situation.
Sure. Okay. So it's all about individual and environment-based risk assessments.
Totally.
Everything is different.
Totally. Yeah. And some of us will be more comfortable in terms of leaving our masks on or taking our masks off in different settings.
Okay.
I think we just got to get really used to this as a society. Actually just weighing that up for ourselves and scanning the room and looking at what we can do. When I enter a room now, I think about, do I take my mask on and off? But the other thing I look at is, can I open any windows in this space? It's a really simple thing. And I think it's a little bit like learning how to drive. When you learn how to drive, it's all unfamiliar at first, but you learn to scan the road and you learn to kind of read it. And that's what I've started to do with indoor environments.
Yeah, right. Looking for hazards.
Yeah.
Yeah. Okay.
Jen's probably better at that than me.
Now, also on the topic of vaccines, we've had a couple of questions around Omicron-specific vaccines. What are we seeing in this space happening overseas?
Good question. So both Pfizer and Moderna have developed Omicron-specific vaccines. Again, they were tweaked for BA1 and BA2, and we're down at BA4, BA5, so they're tweaking again. But they're also looking at the protection these Omicron-specific vaccines have for BA4 and 5 as well. So those studies are being concluded, and we'll see the data. There's some data in what we call preprint, so people are seeing it. That said, we still know from the original vaccines developed with boosters, we may not have as longer protection from all infection that we wanted, but we've still got pretty good levels that can be achieved to decrease our rates of severe illness and hospitalisation. So I wouldn't be buying an Omicron-specific vaccine unless it was giving longer protection, higher levels of protection against those severe outcomes, or if it offered zero side effects. You've got to be buying something that offers you an advantage rather than it's the new shiny thing on the shelf. And so if you read people around the world, they're really waiting for that data before they commit to anything.
Okay. You've sort of talked around the answer, but I'll ask it anyway as we were asked it. If there is a vaccine targeted to Omicron and its subvariants on the horizon, is it better that people wait for it, or should they go and get vaccinated with what we've got?
Go and get vaccinated with what we've got. The one thing I would say is if this new vaccine comes out, it will still be available to people to top up their immunity, to push it out. What you don't want to do is to wait for something that we have no horizon on when it's going to arrive and run your risk that your immunity is dropping off when you can do something about that. You can lift it with what we've got.
Okay. Nick, this might be one for you. So we're sort of rattling through numbers of Omicron subvariants at the moment. Someone has asked, how are COVID-19 variants determined, and what qualifies a variant from a subvariant?
Short answer is it's complicated, and a lot of virologists and scientists who work in genomics make some of those determinations, as well as epidemiologists. So you've got the WHO's Greek letters, and then they've put this new category in of subvariants of Omicron, and so these are sub-lineages. They differ somewhat genetically, but there's not quite the evidence to say in all of these different characteristics how much they transmit, their ability to get around immunity, or how severe they might be. It's not quite the evidence to say this is a whole new variant, and so that's the system they've got at the moment. We're actually still really waiting to see BA4 and BA5, whether they're sufficiently different enough from the other Omicron we've seen to potentially give it a new name. The WHO has an expert technical group that does that sort of thing. I definitely agree that it can be confusing, and it was nice to get away from the numbers for a little while, and now we seem to be back at them.
Yeah, okay. Okay, so with the sort of trajectory of COVID-19 and the fact that it has continued to evolve, and these new variants and, as you say, subvariants within those keep cropping up, when would that not happen? When does a virus get to a point where it stops evolving? Does that ever happen? Or is what we're seeing right now happening because we've got patchy vaccination coverage in countries worldwide? Is it that people are becoming chronically infected and new mutations are developing? What's going on, and when does that sort of stop happening?
Yeah, I'd love to be able to give you a firm time frame, but
Right.
this is what viruses do.
Yeah.
So viruses, where we have no protection, they infect people, they spend time in people, and they gain a chance to mutate. In certain people where they're unable to clear the infection, those that don't have good immune systems for some reason, they can mutate at a higher rate because they've just got the opportunity to. They spread on to someone else. As that population of people becomes less and less through vaccination, natural immunity, combination of both, the opportunity for the virus to mutate in a single person gets less over time. And so it's the speed in which we see mutations that is really the key thing here in terms of new ones cropping up. Remember, we think back last year, how many ones were sort of cropping up? And yes, we've got BA4 and BA5 and 2.75, but not as many as what we were seeing early on. So there is a rate of slowing. We shouldn't say that's definitely the way things could go, because as a new variant gets immune escape, again, that just offers another chance for it to get into us and mutate again. I would say a really important part of what the WHO has encouraged countries to do is to contribute vaccine to those countries where they don't have the money to buy vaccines, because they offer an opportunity for us to reduce the likelihood mutations develop in those populations. That's a really important part of our worldwide public health strategy.
Yeah, right, okay.
And the thing that we can do to stop new variants coming is reduce the number of infections. Cut off those opportunities for it when it's replicating in somebody to get a new mutation. The best thing that we can do to prevent that is going to be reduce the infections that might get passed on between people.
Okay. Now this might be a hard one to answer. I'm asking you to all get your crystal balls out and see sort of what's on the horizon. But so we're sort of waiting on the modelling from the school holidays as to what the next couple of months might look like. But do we have any indication as to what comes next in the worldwide fight against Covid-19? Is it likely, as long as these high rates of transmission continue, that we'll see more mutations cropping up and into next winter? I mean, should we expect a similar experience to this year? Nick or Anthony?
I would say COVID hasn't finished with us just yet. There will be another wave at some point. The timing of that wave is dependent on a lot of factors we've already discussed here today. What I would say is every year we're further into the pandemic. If you look internationally at first waves, second waves, third, fourth and fifth in country, those waves are getting less, and we're sort of moving internationally anyway, not necessarily. We're early on in our COVID wave journey. Cases sort of just trickling along at a relatively high level from what we're comfortable reporting. You know, we would prefer it to be the old days of there are 2 cases of COVID today. But actually, we've moved to the point where there's probably going to be hundreds, if not thousands, of cases a day in cities around New Zealand, regardless of tens of thousands that happen in bigger countries around the world. And we'll see those sort of cases trickle on. It's different to flu though. Every year you get seasonality. COVID doesn't really care about a season. What gives COVID an advantage in winter is our proximity. We're indoors, we're much more likely to share things, and so that helps to, if it's summer and we're outdoors and we're doing everything to reduce transmission, then the wave may not be as substantial. So my crystal ball will be COVID's with us for a wee while longer. We'll just see the peaks of COVID numbers come down over time.
And I just want to acknowledge that that's sort of psychologically hard for people to hear. I think that a lot of people across New Zealand have done the right thing. They've gotten themselves vaccinated and they've paid close attention to public health advice. We had very high compliance in the early part of our pandemic control. And so I just want to acknowledge that, it is tiring, but, think of it like this is a marathon, not a sprint. And we just need to continue to pull together and to take care of each other and to take the steps that will do that.
Yeah, great. Well, that seems as good a place to end our panel today as any. I'd like to thank our panel for coming in today, and thank you to those of you who sent through questions. It's greatly appreciated. Take care of yourselves, and we'll see you next time.